Okay, so a lot of you have requested that we take a deep dive into this Robert F. Kennedy Jr. situation
Yeah.
and his potential appointment as head of Health and Human Services if Trump wins a second term.
It's certainly been a controversial topic.
It has, and we've got a lot of sources here, but the main one is this CNN article that goes through his plans and what a lot of experts are saying, and the reactions have been
Mixed, to say the least.
very mixed. Yeah, some people are hopeful, some people are very concerned.
Yeah, there's definitely a lot of strong feelings on both sides.
So is this a good thing for the future of public health, or is it a potential disaster? Let's see if we can unpack that.
I think a good place to start is with Kennedy Jr.'s own words, right? He hasn't exactly been shy about sharing his vision for HHS.
No, not at all.
He's already laid out some pretty ambitious goals, like, tackling what he calls corporate capture and corruption within the department.
Right, he's all about cleaning house and getting back to what he considers like pure science.
Yeah, evidence-based science is the term he uses a lot. And he's really emphasizing transparency. Like, he wants to give Americans more information so they can make their own decisions about their health.
I saw a quote in the article where he said,
Oh, yeah.
I'm looking forward to working with HHS's 80,000 employees to liberate the agency from the stranglehold of corporate capture so that they can pursue their mission of making Americans healthy again.
That's a pretty bold statement.
It is.
It sounds like he's ready to shake things up.
Big time.
And, while there might be some agreement on the need for some changes within HHS, the how is where things get a little tricky.
Right.
Especially when you consider Kennedy Jr.'s past views on certain health issues, like vaccines, for example.
Oh, yeah.
That's where a lot of people start to get really concerned.
Yeah, his history with the anti-vaccine movement has a lot of health experts worried.
Yeah, and for good reason. I mean, we're talking about decades of research, countless studies,
Right.
real-world evidence that shows vaccines are safe and effective.
The CDC estimates that childhood vaccinations alone will prevent millions of illnesses and deaths in the coming years.
It's a huge public health success story.
It is. But Kennedy Jr. has been a prominent voice in that anti-vaccine movement, and he's promoted a lot of claims that have been debunked by scientists time and time again.
And it's not just about words either.
Oh, are you talking about that measles outbreak in Samoa back in 2019?
Yeah, the CNN article suggests that Kennedy Jr.'s rhetoric might have actually contributed to vaccine hesitancy there.
Oh, wow.
Which led to a tragedy that claimed dozens of lives, mostly children.
And if that's true, that's incredibly serious.
It is. It really shows the potential consequences of spreading misinformation, especially when it comes to something as important as public health.
Samoa's outbreak was just a stark reminder of how quickly a contagious disease can spread when vaccination rates drop.
Exactly.
And it makes you wonder, how much influence does a figure like Kennedy Jr. really have? And what could that mean if he actually starts making policy?
Right. It's a very valid question.
Now, in fairness, the article does mention that Kennedy Jr. seemed to soften his stance on vaccines a bit before the election.
Oh, right.
He says that he's not anti-vaccine. He just wants more transparency when it comes to safety studies.
Interesting.
But even with that, some experts are skeptical about this sudden shift.
Yeah, I can see why.
What do you think? Is it genuine?
I mean, it's tough to say for sure, but the thing is, data on vaccine safety and efficacy is already publicly available.
Right.
It's constantly being monitored. We've got the FDA and the CDC with their rigorous testing processes.
Yeah.
So some in the medical community see this focus on transparency as a way to undermine public trust in vaccines without really offering any new evidence.
Okay, so even if we put aside all the concerns about transparency and corporate influence in healthcare, Kennedy Jr.'s history with vaccines is definitely something to watch closely.
Definitely. And it's not the only area where his views clash with mainstream science.
You're talking about his stance on fluoride in drinking water.
Yeah, exactly. Kennedy Jr. has said that he plans to advise water systems to remove fluoride because he's concerned about potential health risks.
Okay, so that puts him at odds with decades of scientific and medical consensus that supports adding fluoride to water.
Right. The American Dental Association is a big proponent of fluoridation, and countless studies have shown it's a safe and effective way to prevent tooth decay.
But there's also that recent federal court ruling that adds another layer to this whole debate.
Oh, that's right.
The court actually found enough risk to warrant further investigation into fluoride's effects on children's IQ, and they called on the EPA to review its regulations.
So even though the ruling doesn't say we should stop adding fluoride to water altogether, it does raise some legitimate questions.
Yeah, it does make you think.
And it's interesting because even though most health organizations still maintain that water fluoridation is safe, this ruling acknowledges that there might be some risks, particularly for children's development, that need more research.
So how do we balance those potential risks with the known benefits of fluoride, especially when it comes to communities that don't have access to regular dental care?
That's a really tough question, and it shows just how complex these public health decisions can be.
And then on top of all of this, Kennedy Jr.'s views on infectious disease research have also caused a lot of controversy.
Oh yeah, Dr. Michael Osterholm, who's a leading expert in infectious diseases, has been very vocal about his opposition to Kennedy Jr.'s suggestion to cut funding for infectious disease research at the NIH.
Yeah, he called it a potentially disastrous move.
Especially in light of everything we've been through with the COVID-19 pandemic.
It does seem like a pretty radical idea considering how important that research has been, not just for responding to outbreaks, but also for developing new treatments and prevention strategies.
Exactly. The threat of new and evolving pathogens is always there, and stopping research in this area just seems incredibly short-sighted.
So the big question is, what would Kennedy Jr.'s alternative approach to infectious disease research be? Like, would he even have one?
And what are the potential consequences of that? We really need to dig into that further.
Yeah, there's a lot to unpack there.
Definitely.
So far, we've got potential conflicts over vaccines, fluoride, and infectious disease research.
It's a lot.
But the CNN article also mentions a surprising area where Kennedy Jr. might actually find common ground with some unexpected allies.
Oh, really?
Yeah, food policy.
Oh, interesting.
It seems that he's a big advocate for regulating chemicals in food and encouraging healthier eating habits, especially for kids. He even has some pretty unconventional ideas about, like, making McDonald's fries healthier.
McDonald's fries, that's a new one.
But the really interesting part is that he seems to have found an ally in Marion Nestle, who's a very well-respected food policy researcher.
Wow, that's surprising.
She actually agrees with some of his goals for improving the food system, even though she acknowledges his controversial past.
So even though Kennedy Jr.'s stances on things like vaccines and fluoride are causing a lot of concern, there might be some common ground when it comes to tackling the broader issue of food and nutrition.
Yeah, it adds another layer of complexity to this whole situation.
For sure, it suggests that even in the midst of controversy, there can be areas of agreement and maybe even some potential for productive dialogue.
The question is, how will all of these competing perspectives actually play out in terms of real policy decisions?
Yeah, and what impact will those decisions have on the health and well-being of all Americans? That's what we need to figure out.
Those are the million-dollar questions, and we're just getting started with this deep dive, so stay tuned because we've got a lot more to explore.
You know, it's kind of amazing how this situation really makes you think critically about things.
Yeah.
On one hand, you've got someone like Kennedy Jr. who has a history of making some scientifically questionable claims. But then on the other hand, he's bringing up some valid concerns about the influence of corporations and health policy, and he's actually advocating for some positive changes in our food system.
Yeah, it's like a puzzle where the pieces don't quite fit together.
Right.
You've got experts like Dr. Osterholm warning about potential disaster if he acts on some of his ideas. And then you have someone like Marion Nestle, who's a leading voice in nutrition and food policy, actually agreeing with him on things like food additives and access to healthy options.
Yeah, it's definitely not a simple situation.
So how do we make sense of all of this?
I think it shows how important it is to look beyond just the headlines and really dig deeper.
Yeah.
You can't just accept any one perspective at face value.
Right.
You have to examine the evidence, consider the consequences of different policies, and be willing to challenge assumptions even when they come from sources you might generally agree with.
So where do we even begin? What should we be paying attention to as Kennedy Jr. takes on this powerful role?
I'd say the key areas to watch are the ones where his stated goals clash with what most scientists agree on.
Okay.
Like vaccines, for example. That's going to be a major flashpoint.
Yeah.
Will he try to restrict access to vaccines or spread doubt about their safety? And how could that affect vaccination rates, especially in communities that are already hesitant?
What about his plan to advise water systems to get rid of fluoride? Is that something that could actually happen?
Right.
And what would that mean, especially for people who rely on public water systems?
Those are really important questions. And that recent federal court ruling on fluoride has added a whole other dimension to the debate.
Yeah.
I mean, the ruling doesn't say we have to remove fluoride from drinking water.
Right.
But it does say that the EPA needs to take another look at its regulations.
Right.
And that could give Kennedy Jr. more leverage to influence local water systems.
Yeah, especially if he frames it as an issue of like local control or giving people more choice. But wouldn't that be really bad for dental health? Especially for people who can't afford regular dental care.
Well, that's what a lot of public health experts are saying.
Yeah.
Fluoride has been a key part of preventative dental care for a long time.
Right.
And studies show that adding fluoride to water really does reduce cavities.
So how do we weigh those potential risks of fluoride that the court brought up against the proven benefits? It's a tough call.
It really is, and it feels like we're heading into a very uncertain time when it comes to public health policy.
Yeah, it does.
And remember, the Department of Health and Human Services oversees a huge network of agencies and programs.
Yeah.
It affects almost everyone in the country, from Medicare and Medicaid to the FDA and the CDC.
Right.
Decisions made at HHS have far-reaching consequences.
Yeah, it's not just about abstract policies. It's about people's lives.
Exactly.
Okay, so we've got these potential conflicts over vaccines and fluoride, but what about his stance on infectious disease research? Dr. Ostrom was pretty alarmed by his suggestion to cut funding to the NIH.
Right, and that's a big deal.
Yeah, what are the implications of that? And are there any other approaches that Kennedy Jr. might consider?
Well, the COVID-19 pandemic really showed us how vital it is to invest in infectious disease research.
Yeah.
It's not just about reacting to outbreaks, it's about developing new treatments, vaccines, and ways to prevent these diseases in the future.
Right.
To suggest stopping that research when we're still facing threats from new and evolving pathogens just doesn't make sense.
So what would a responsible approach to infectious disease research look like under a Kennedy Jr. administration?
That's the big question, isn't it?
Yeah.
We can speculate, but we'd really need to look at his past statements and writings to see if there are any clues.
Yeah.
Maybe he'd shift research priorities towards certain types of diseases or explore alternative approaches to treatment and prevention.
Could he be more focused on personalized medicine?
Possibly.
Or preventative measures that empower individuals to take control of their own health?
Yeah, that's possible. He's talked a lot about individual choice and personal responsibility when it comes to health.
Right.
So maybe he sees a system that emphasizes lifestyle changes, alternative therapies, and a more holistic view of healthcare.
That would be a big shift from the current system, which tends to focus on treating diseases after they develop.
Exactly, and it raises a whole bunch of new questions.
Yeah.
Like, how would you implement that kind of system? How do you ensure everyone has access? And how do you even measure if it's working?
Right. Would it be more cost effective? Would it lead to better health outcomes?
Exactly. Those are all things that would need to be carefully considered.
So it sounds like we need to do a deep dive into his writings and everything he said about healthcare in the past to really understand his philosophy and what his alternative approaches might be.
Yeah, I think that would be really helpful.
We need to go beyond just the sound bites and really explore his thinking in more depth.
And we need to think about the potential implications of his ideas, both good and bad, from a scientific, ethical, and societal perspective.
Right. It's a complicated issue with no easy answers.
It is.
But it's one that deserves our full attention.
Absolutely.
Okay, so we've talked about vaccines, fluoride, and infectious disease research. We've also touched on this potential common ground with food policy.
Right.
But what does all of this mean for the future of public health in the United States? Where do we go from here?
That's the crucial question, right?
Yeah.
And to answer it, we have to think about the potential ripple effects of his leadership. His decisions at HHS will affect everything.
Yeah.
From access to healthcare and the cost of prescription drugs to environmental regulations and public health messaging.
It is a lot to take in.
It is.
And I have to admit, I'm feeling a little overwhelmed.
I understand. It's a lot to process.
Yeah.
And there are a lot of unknowns.
Right.
But I think the first step is just acknowledging how complex this all is.
Yeah.
There are no easy answers.
Right.
And then there will be trade-offs and compromises no matter what direction we choose.
So instead of looking for simple solutions, we need to embrace the complexity
Yes.
and have thoughtful, nuanced discussions about the kind of future we want for public health in this country.
Exactly. We need to be open to hearing different perspectives.
Right.
Considering a range of options
Right.
and weighing the potential benefits and risks of different approaches.
And we need to hold our leaders accountable
Absolutely.
for making decisions that are based on evidence and guided by ethical principles.
Yes. And that are truly in the best interest of the public good.
It sounds like a tall order,
It is.
But it also feels empowering to know that we have a voice in shaping the future of public health.
You absolutely do.
Yeah.
Public health isn't just about government policies and programs.
Right.
It's about the choices we make every day,
Yeah.
the communities we create,
Mhm.
and the values we prioritize.
Right.
We all have a role to play in creating a healthier future for ourselves and for generations to come.
This whole deep dive has really changed how I'm thinking about this. Yeah. I came in thinking this was just about Kennedy Jr. and all the controversial stuff he said.
Right.
But now it's like I'm seeing this much bigger picture.
Mm-hmm.
It's about all the complexities of public health
Yeah.
and how much power the government has and how do we balance what individuals want with what's best for everyone as a whole.
It's a tough balance.
It is. And it's easy to get caught up in like the headlines and the immediate drama.
Yeah,
But it's important to step back and think about the bigger picture.
absolutely.
Public health isn't just about reacting to crises. It's about making sure people can actually thrive
Right.
physically and mentally.
It's about creating the conditions for good health
Exactly.
for everyone.
It's like you can't just tell someone to eat healthy if they live in a place where there's no grocery store with fresh produce,
Yeah, it's not that simple.
or if they can't afford healthy food,
Right.
or, expect people to exercise if their neighborhood isn't safe or there's nowhere to walk or bike.
Right. There are so many factors that influence our health that are beyond just our individual choices.
And that's where public health policies and regulations and investments really matter.
Yeah, they have a huge impact on the environment we live in.
The places where we work and play,
Exactly.
things like access to affordable health care, clean air and water, safe food,
Yeah.
resources to help people with their mental and emotional health.
The government can really make a difference in all those areas.
So it's not just about what happens inside HHS. It's about how those decisions affect communities all over the country.
Absolutely. Think about it.
Yeah.
If Kennedy Jr. goes ahead with his plan to tell water systems to stop adding fluoride,
Right.
the communities that are going to feel that the most are the ones that already have a hard time getting dental care.
That makes sense.
Same thing with vaccines.
Yeah.
Any changes to vaccination policies could have a bigger impact on some communities than others.
So we have to think about fairness
Yes, equity is crucial.
and make sure we're not making things worse for the people who are already struggling.
We can't just create or widen the gaps that already exist.
I remember that quote from Kennedy Jr. where he talked about freeing HHS from corporate capture.
Oh, yeah.
It makes me wonder about how much influence these big companies have,
Like who?
like the drug companies, the insurance companies.
Right, all the big players in healthcare.
Yeah. How can we be sure that decisions about public health are actually based on what's best for people and not just about corporate profits?
That's a great question, and it's one we should always be asking.
Yeah.
Transparency is so important.
Right.
We need to know about the connections between the people making policies and the lobbyists and the campaign donors.
And we need people keeping an eye on things.
Exactly. Independent watchdogs and investigative journalists.
Yeah. To hold those in power accountable.
And the public needs to be aware and engaged.
So it's not enough to just hope that the government will do the right thing.
No, we have to be informed. We have to participate and speak up for the policies that will make everyone healthier.
Public health is everyone's responsibility.
It really is.
And it takes all of us working together to make a difference.
That's a great way to put it.
Well, this deep dive has given me a lot to think about.
Me too.
Honestly, it feels like we've uncovered more questions than answers,
That happens sometimes.
but it also makes me feel like I need to learn more and get involved.
That's the beauty of a deep dive. It's
Yeah.
not about having all the answers. It's about opening up new ways of thinking, challenging what we thought we knew,
Right.
and making us want to learn more.
Exactly. The more we learn and talk about these issues,
Mm-hmm.
the better we'll be at advocating for a healthier future.
Couldn't agree more.
So for everyone listening, don't stop here.
Yeah, keep digging.
Go back to the sources we talked about.
Explore different perspectives and think about what you can do to help create a healthier and more just world.
Because public health affects all of us. And we all have a part to play in making things better.
That's a great message to end on.
Thanks for joining us on this deep dive.